how did it get started? Why did it get started? And basically, how is this thing going to work?
Yeah, so Take Good Care Mental Health First Aid is basically just an initiative to provide mental health first aid to training to Arkansans. And, the best part about it is that it's going to be at no price, no cost to Arkansans. So now through September, we're going to be offering at least 8 classes every month all across the state of Arkansas. We really want to make sure that the training is accessible to all Arkansans. So, for example, one thing we're going to be doing is, like I mentioned, making sure it's free. You don't have to be an Arkansas Blue Cross Blue Shield member to take this class. It's truly for all Arkansans. Mental health first aid, just to kind of talk about what it covers, they're going to be learning about issues that we all think about when we talk about mental health. So anxiety, depression, addiction. And many times people with those issues can look just fine on the outside, but on the inside can be completely falling apart. And the good thing about mental health first aid training is that it's going to allow the individuals that take that class to maybe be the only person that sees that struggle, and gives them the tools that they will need to basically recognize that person's pain and to offer help. And, I think for people that are watching this online, I want them to know that the class is not hard. In fact, it's very interesting. The information is very interesting and applies to everyone. And you get information prior to going in the in-person portion of the class. It's about 2 hours of online work that they send out to you that gives you the background knowledge that you need to really go into the class and feel confident during that in-person portion of the training. And the in-person training it's a full day. And that may sound a little daunting to think you're going to spend a full day of training, but it's from 10 a.m. to 4:30 p.m. We'll offer lunch. But the good thing about it is it's not just going to be Monday through Friday. If that's when you work, we're also going to offer it on Saturday. So we're truly trying to make this class as convenient as possible, for everyone that's going to be a part of it and everyone that wants to take part in this class.
So who can be a part of this, and
Yeah.
how do you sign up for it?
So it truly is a class for absolutely everyone. A teacher, a parent, a first responder. You think about a CEO walking into the room. It is absolutely for anyone that wants to be equipped to help someone who might be struggling with mental illness. Registration is simple. You just go out to arkansasbluecross.com and look for, and it's actually /first aid, but just look for that information. And, you're just going to give a little bit of simple information about yourself, your name, your address, phone number, email, so that we can then send out the materials that I mentioned for that background online class portion. And, I suggest everyone get out there as soon as possible and sign up for these classes, because they are hands-on and super engaging. They're going to fill up fast, and the class sizes are smaller and are going to be limited. But if you don't see your class that you really wanted to take, if it's full, go out to the next month. Look, we're going to continue to add classes. We're going to be offering these in all 4 corners of the state, and in the middle, just look for your area. They'll have them in the Delta, in South Arkansas, North Arkansas. We're going to be all over the state, really trying to provide access to the classes.
Part of the situation that I think people will or have trouble with, or at least have a getting what to know, what to say to get the ball rolling on this. Will those classes talk about that?
It's going to cover that. And you're so right. You don't want to say the wrong thing. And I think so many times you might sense that something's wrong with someone and you don't want to cause more harm. And so the mental health first aid class truly does equip you with the right words to offer help and to allow these individuals to seek the help that they need. we talked about prior to the interview, the impact that this class could have.
I was going to say, this has got to be, at least from what I understand or from what I know, this has got to be one of the biggest things like this in the country.
Right. And when I think about this class and the impact it's going to make, you know, like many other health issues, but I think with mental health, especially right now, it affects us all. I mean, if you stop and think about 5 people that you know personally, it's very likely that one of those people is living with a mental health condition and, maybe even suffering in silence. That's the hardest part about mental health is people don't always talk about their struggle. We'll talk about a sprained ankle, we'll talk about heart disease all day long, we'll talk about diabetes, but for some reason it's harder for us to talk about our mental health concerns. And so, mental health first aid provides people with that important information and just a perspective to be able to recognize those that may be struggling and in need of intervention. Between now and September, 750 people will be trained. And, you think about that impact, 750 sounds great, but they're going to talk about this training with the people that they work with their family members, with their friends. And, we're not the only ones offering this training. I think we're the only ones offering it at no cost and making it convenient for others. But just to have that impact across our state and know that it's going to multiply and make such a difference in people's lives, it gets me, as a team member at Arkansas Blue Cross and Blue Shield, so very excited. So again, go out to the website, sign up, register for mental health first aid. We're going to be offering 8 classes per month, all across the state between now and September.
There seems to be, even though all of this talk that has taken place over the last 2 or 3 years, especially during the pandemic, there still seems to be a stigma with this that, well, it's not happening to me. I don't have any problems. And that's what needs to be talked about and will assuredly be talked about in these classes.
Yes. So you're so right. And, none of us have a problem driving up to our primary care physician's office and parking in front of it. But, you ask someone to go and seek help for behavioral health conditions and it becomes another issue. And so, I think one thing that this class can do is to normalize the conversation around behavioral health and normalize the fact that it's okay to talk about these issues, just like our physical health conditions, and to address them. And so, if we can get 750 more people around our state that understand and can recognize mental health as something that we all deal with and we all should address in our own health every single day, that's one step ahead in breaking that stigma.
All right, give us the website again, the web address to sign up, and are there deadlines to getting signed up, or can you do that all the way through the end of September?
Yeah, so as long as we're adding classes and locations, everyone can sign up. But like I said, in order to get the class you want, I would recommend going out there now. We will be continuing to add classes and locations though. So it's arkansasbluecross.com/first aid.
Rebecca, thank you so much.
Thank you.